is my pleasure to introduce our first speaker, Dr. Byron Buss Tarbox. Dr. Tarbox is an orthopedic surgeon with the Columbia Orthopedic Group. Please welcome Dr. Tarbox.
Thank you, guys. I appreciate you having us over to talk. I think it's a great opportunity to discuss concussion. I know this talk goes on yearly, or I've heard it has in the past. And in preparing for today, it's interesting to go back through and think about it. And I've been in sports medicine now. I started my practice here in 2001, and all the different events and all the different football games and wrestling matches and whatever I've covered throughout my career, the different head injuries that I've seen and really the sequelae and the spectrum that we see. And so I think it's interesting in light of all the top of the mind media attention to concussions right now, the Will Smith movie, all the stuff we're seeing in the NFL. I think this is really a pretty interesting topic, and you know, the more we learn about it, obviously the more we understand. So I'd like to introduce, I brought two students that work with me. One, my daughter, Kylie Tarbox, and Maddie Giroux are seniors at Rockbridge, and they work with me as interns in my practice. They're both interested in a health-related field, and as I was driving over here, it was interesting. Both these young individuals have had concussions, and knowing these girls as long as I had and going through their concussion sequelae at the end of it, I brought them in. Hopefully they'll remember what I say, right? So anyway, so let's get started. Quickly, we'll kind of go through our outline. I've been asked or tasked to define and discuss just concussions. Everyone in this room should have a pretty good understanding of concussions, and so let's start the day off with just kind of a reminder of what concussions are and how it goes. One of the problems we have with concussions is how do you define concussion? If you go to the literature, there are several different definitions of concussion, and it changes based on who's making the recommendation. And you see the Congress of Neurologic Surgeons sound very, clinical syndrome characterized by the immediate and transient post-traumatic impairment of neural functions, such as alterations of consciousness, disturbance of vision, or equilibrium due to brainstem involvement. Can you imagine talking to a parent of a child who just had a concussion on the field and say, here's what your son or daughter has? It's really wordy and hard to understand, all the way down to just a mild traumatic brain injury. In fact, the Mayo Clinic defines as a traumatic brain injury that alters the way the brain functions. Well, I think that's a good way to start when we're speaking to family members and parents of individuals. So, interesting, my older daughter, who's a health professions student at the University of Missouri, just gave as part of her health professions talk, gave a concussion talk last semester for a final project. And I was looking at some of her stuff, and I'd not ever seen this statistic. I don't know the validity of it, but think about this. A professional football player gets hit in the head, according to this study, 900 to 1,500 times a year. You imagine that? And now we wonder why there's an issue nationally. This is a problem. We understand concussions. They've been around a long time. It's now come to the forefront. And in an anonymous survey, this is a quote, in an anonymous survey by ESPN, 85% of players polled said they would play in the Super Bowl with a concussion. Why not? I've made it to the big game. Excuse me. I'll hide the fact that I have a concussion. I'll play. Now, this director of Dave McClellan, who was my best friend growing up, he's now the director of recruiting for Oakland Raiders, played 4 years in the league. In fact, his brother is now the GM for the Washington Redskins. When my daughter interviewed him and asked him about concussions while he was in college in the league, he said, and this is a pretty good quote, excuse me, some kids have nothing else, so they fake that they are okay so they can keep playing. They need to get to the pros. They came from nothing. That is why the player no longer makes the decision. Right? I got to get out of college. I got to get out of high school. I got to get to college. I got to get out of college. I got to get to the pros. I need to make my money in the pros, so I have nothing else. This is why this is a problem, all right? So let's think about it. Concussions. It's easy to understand. A direct blow to the head or face. There are some impulsive force. You can transmit force to the head. Anytime there's some sort of concussion type or some sort of injury in which the brain itself floats around in the cranium and bangs up against the bone, we're going to have some issues. It's short-lived, typically. You get impairment of neurologic function, and you get this may or may not have a loss of consciousness, and resolution typically follows. If we were to study, typically you have normal imaging. The interesting thing, I remember a kid we had at Rockbridge several years ago, got a concussion in the first half, and we were doing our SCAT testing to check him out. And I remember when we would ask the question, Greg Nagel, our athletic trainer, would ask the question, he would think about it, and then come up with the answer. Well, at halftime, we took him in the locker and we pulled him from the game, and we said, you can change out of your gear because you're not going to play second half. And I remember just watching this poor kid try to figure out how to get into his locker, and he couldn't remember his combination. At the end of halftime, he came to us and he was dressed. So over the course of that 15-minute halftime, it finally came to him. He had a delayed, short-lived impairment in neurologic function, was able to get it, but obviously was impaired. So let's talk about the prevalence of concussions. This is pretty interesting. If we think about what you hear about in the news, multiple sclerosis, HIV, breast cancer, traumatic brain injuries are one of the highest incidents of annual incidents compared to some of the other stuff we hear. I'm not downplaying any of those other incidents. We do have a problem. And if you look here, this statistic always comes up. We did high school physicals on Saturday, and we did our pre-screening concussion testing, and women's basketball was in there. The main sports that we see, women's basketball, boys soccer, women's soccer, football, and wrestling comes in. Those are the main sports that we see this. I'm not sure why girls basketball has such a higher incidence of concussion than males. Not sure I understand that. Soccer, this is interesting. I put this slide in here because it's interesting. 79% of goalies have an incidence of a concussion. Goalies, okay? You would think you see the defense or the midfielders, right? It's the goalies that are getting the concussion, the big collisions on the breakaway ball, probably. Or head-to-head contact, hand-to-head, ball-to-head, head-to-ground is what it can happen. So this is a 3-year study out of the NCAA, back 2003, 15 sports studied, 40,000 plus reportable injuries. Concussions accounted for 6% of the injuries. Again, we have, and it's interesting, males had more concussions during practice as opposed to females that had it more during the games. But we see lacrosse, soccer, hockey, again, football, basketball, and wrestling again. So the stats are pretty typical. Reason why we need to understand concussions and need to be aware of it and need to treat it is, look at this stat. If you've had a previous concussion, you have a 1.5% or times risk of having another concussion. When you've had 3, you're 3.5 times more susceptible to concussion again. So in case of my daughter, who's had about 2, she can't remember how many she's had, post-sequelae. No, but once that brain gets injured, especially she's young, and in her population, there's a higher risk of that. That would be a disaster. That's just a nasty photo. So let's talk about what the athlete feels. We've seen concussed patients. Let's talk about it. Headache, nausea, balance problems, dizziness, double vision, fuzzy vision. And really, as we've done in Columbia Public Schools, in our high schools, in our junior highs, we use the SCAT 3 now. The one thing I've found remarkably, really sensitive is the balance problems. Some kids can kind of mentate through some of the questions, but it's the balance issue that I see that is really sensitive of someone who's had a brain injury. I think that's something to really watch on. I guess that makes sense. If someone's drinking, coming out of the bar, they're usually stumbling anyway, so it kind of works the same way. So sensitivity to light, noise, feeling sluggish, feeling that little fogginess, and really concentration and memory problems. The one question I ask the kids when I'm seeing them is, are you able to read? Were you able to do homework last night? Are you able to sit down and study? Usually teenagers have a hard time doing that anyway, and now you throw a concussion onto it, it's a little bit difficult. Well, we see, again, kind of the same symptoms that as a practitioner, the student athlete, or just a patient, dazed or stunned, confused, moves clumsy, forgetting short-term memory, maybe a little bit long-term issues. Some of the issues that we got to worry about, there's a lot of concussions we talked about. Some of the problems are young age. The pediatric age, that growing brain is very sensitive to an injury like this, and so we need to be really, really, really protective of that pediatric brain. Any confusion lasting greater than 30 minutes, loss of consciousness, that's always obviously a clinical red flag. And then neurologic deficits, again, and deteriorating levels of consciousness. And so we need to really, really watch these. So what do we do on the sideline? I know there's big pushes now for different monitoring devices, and how do we know? I know I was at a Big 12 team physician meeting several years ago, and they were looking at different implant or things to put in a helmet. So when an athlete hits someone else, if that helmet saw a great deal of force, it would trigger a response, and the physician on the sideline, his pager would go off. He'd pull it out and go, oh, number 58. So then he would watch number 58 and see if there's any signs. And that never took off. Sounds kind of gimmicky. However, it's a neat idea. So here in Columbia, and we got several of our athletic trainers in the area sitting out here from Columbia in our schools here. We actually have now converted to the SCAT-3. And there's talk, do we need to use impact? Do we need to use SCAT? There's all sorts of different tools. And it has been our recommendation, and who knows, it may change, but it's been our recommendation with the help of our athletic trainers here to use the SCAT. And we actually said we moved to the SCAT-3, which gives a little bit more defined evaluation of the neck and gives us a little more discussion of true questions to ask for history of concussions, where the SCAT-2 doesn't necessarily do it. However, this is a tool, and it's a way for us who's all familiar with this test? Okay, so about half the room. So what this is, I have a student athlete that goes down on the field. We can do this test. It's a series of questions which asks memory. Actually, it asks symptoms. Did you see stars? Do you have a headache? Do you have light sensitivity? A bunch of the row of symptoms. It also then does balance testing as well as memory and short-term memory. Recite the months backwards. It's kind of interesting. I'm not sure. Some of that, as these kids are taking the test and our athletic trainers are taking these kids through the test, I'm trying to remember those numbers backwards as well. I'm not sure what my number is without a concussion. No, but all it is a number, and my number may be different than your number. But when I get injured, I go to my number, and if my pre-screened number is 96, and now I'm injured, and I come in and I tested an 86, I know I have some sort of cognitive impairment, so it's a tool. And just because I'm an 86 doesn't mean I'm a B. It just means that I'm lower than my baseline. And what you heard several years ago, some of the NFL guys, I remember someone from the Colts, if I recall, said that as they were getting pre-screened, that he was going to score poorly on it so that his number was lower. So when he had a head injury, he could move his numbers around, which is really scary. This is a really good tool, and it allows us on the sideline at halftime after the game to then tell parents, well, I believe your son or daughter has a concussion. We're now going to go through the concussion protocol, and we'll guide and we'll be able to follow their recovery. What's interesting is you do see measurable deficits when we run through these exams. A decline in score was 95% sensitive and 76% specific for making the diagnosis. Now, Injured subjects, usually they start increasing their scores at about 48 hours after injury. So it's really, again, it's the number. It's just a baseline number. It's a tool, but it's very helpful, especially when talking to family members, if you can get them to understand that. I know and maybe there's some vendors here in the audience of some of the other tools. Impact is more of a computer-based program. Takes a little more man hours to do, woman hours, whatever. I'm sorry, but so far at Columbia Public Schools, we have elected to use this because it's quick and easy, and we can do it. And at our physicals we did on Saturday, we did pre-season testing, baseline testing for all these athletes that fall into football, women's basketball, wrestling. Stephanie, we did cheerleading as well, I believe. We see a lot of head injuries with our cheerleaders. So now, when we talk about concussions, when I was going through my training several years ago, I remember having to take our board examinations, and we taught concussion in our sports medicine stuff, and you go through all these grades. Is it grade 1? Is it grade 2? Grade 3? And in all honesty, it doesn't really matter. When we start talking about management of concussions, all our treatment protocols are really not evidence-based on how grade 1, grade 2, how we treat them. So because of these old forms of classifications, now there's like 19 different management criteria. You can go out there. It becomes really confusing. And so we rather have gone away from classifying it as grade 1, grade 2, grade 3. We got a head injury or we don't, and then we can start treating from that point, which is good. So let's talk treatment. When you're at a game or a sideline or an event, obviously if there's not a physician around or medical personnel, I mean, typically we have our athletic trainers. Obviously, some sort of C-spine injury, loss of consciousness, motor weakness. These are all acute referrals to a higher situation like a hospital. If you have a student athlete or student with persistent, had some sort of event, had a headache for 7 days, still having some post-concussive syndrome sequelae, and is having some issues with concentration, that we probably need to get those athletes or student athletes into physician for further testing. Again, diagnostic imaging, not necessarily, we don't see a concussion typically unless there's much more injuries such as a subdural hematoma. Maybe some PET scans or functional MRIs will be able to do it in the future, but that's obviously a lot of money. But right now, we don't truly have a good imaging study for this. Really what we're all here for is when do we get a return to play? Consistent statement in November of 2008 out of Zurich comes down and says the majority of concussions resolve in a short period of time. In children, that pediatric brain, it may take longer. Incorporate some sort of a testing tool. And then a player diagnosed with a concussion should not be allowed to return on the day of injury. And we'll talk about, there's the second hit syndrome or the second injury syndrome that we see, and we'll put that in here. So really, and through the Missouri Sports Medicine Advisory Committee, based on the Missouri House bill that was passed several years ago, there is a return to play protocol, and based on symptoms, once that student athlete is symptom free and without headache, then we can start running them through the protocol, which then starts with light aerobic activity and then picks up the activity. As long as there's no headache or nausea or any sort of step backwards, we progressed through the protocol. If there's any sort of problem during the protocol step, then we back up and start again. So here, this is actually a little better way to see it. And Harvey, maybe he's not here. I tried to pull off our Missouri form that has been developed for our return to play as our student athletes here in Missouri can use. It's on the MISHA website. Basically, what this allows us to do is when a student athlete has a head injury, we put them through this, and the old adage of, well, they can't play for 7 days, technically that you could get back if it's very mild, but almost this prevents that return to play in about a week. And again, if athlete becomes symptomatic at any level, we drop back a level. So again, some sequelae of concussions will finish up here. Chronic headaches, fatigue, sleep difficulties, irritability, sensitivity to light, noise, and depression. These are the signs and symptoms of I've had a concussion and I'm still developed, or still having symptoms of it. Again, cognitive and balance issues are so very sensitive to concussions. Deficits in academic functioning, and it's really important. And I think here in Columbia, maybe I'm biased, but I do believe that our school nurses, when we have an athlete have a concussion, our student nurses jump on it right away, and they involve the teachers and say, hey, we have a concussion here, help us out. And it is in my perception as a caregiver, and maybe our athletic trainers can help me out, but it is my perception that our school nurses do a really good job of helping our student athlete return back into the classroom. And it seems like the teachers themselves have been very, very agreeable and helpful in this situation. Second impact syndrome. This is the big thing that I remember when I was going through my training, really started to come out, and this is the second injury that occurs in a short period of time right after the initial injury. So I get a concussion on Friday, I go back to practice Monday and get hit again. The chance of death goes up quite significantly. Death goes up quite significantly, and really is quite significant. And this is scary. The second impact syndrome, 100% morbidity, meaning that there is going to be some sort of permanent damage to the brain, some sort of short-term memory loss, cognitive ability to concentrate, something. And obviously, I said death. Story of a kid in Kansas who died. So these stories occur, and it makes us all just grab our hearts, right? When any athlete dies on the field. And so this is why we're here today, and this is why you guys are here, and I appreciate it. So athletes typically aren't aware that they may or may not have had an injury. We really have to educate our coaches to understand that. Again, the recurrence rate, once you've had one, it starts going up to have a higher incidence or chance of having another concussion. NFL athletes, 2,500 NFL athletes out of this North Carolina study, quarter of them, or 20% of them, recalled sustaining 3 or more concussions during their play. And now we're seeing a lot of this stuff that you're hearing about now, clinical depression with these concussions. House bill, Josh was here a little while ago. This is the Missouri House bill that when an athlete comes off the field and has any sort of a head injury, they are not allowed to return for 24 hours, and then they go through the concussion protocol. When this first came out, I was a little bit skeptical of this because I was worried about what would happen in the smaller towns and areas around. But I think as this has moved on, I think this has been a really good aspect to. I don't like lawyers telling me how to practice medicine, but I think this is actually pretty good for our student athletes. So, no player with a concussion should continue to play in a game or return. Any individual sustaining a concussion should stop doing that activity that causes symptoms of a concussion increase. So, and this is that kind of return to protocol. If I'm doing something post-concussion, I get a headache, stop. Okay. Again, do not return until symptom-free and have gone through the concussion protocol. And again, probably all sports and health education programs in the schools should talk about and teach concussions, signs and symptoms, and understand the severity and the significance of concussions. One of the things I didn't really talk about is when we see a student athlete down on the field, we really need, if there's truly a loss of consciousness, we need to worry about a cervical spine injury and make sure we don't have something there. and not the kids run out and, hey, he's knocked out, and they start rolling the kid around trying to wake him up. That's not good. So when in doubt, err on the conservative management side. And this is the website. I think maybe the address that's in your handout may be wrong. I looked it up. It looks like they may have changed. But this is a website through the CDC that actually has pretty good information on concussions. And I think the thing is education. I have a student athlete injured on the field. If I have a concussion in one of my athletes, I try to grab the parent out of the stands and bring them down and have that discussion and start educating the parents about this. And so I think that any sort of educational help or anything we hand to the parents after an injury is good. So, all right. Thank you. That's the end. I hope that kind of got through. I kind of went through a lot of stuff in a quick period of time, and I hopefully you guys all understand all that. Any other questions or anything?
On this Missouri HB 300, is the athletic trainer qualified as the licensed healthcare provider?
Yes, that is correct. Yes.
If the athletic trainer has diagnosed the athlete with what she or he thinks is a concussion, and the student goes to a doctor,
Yes.
and the doctor says, "Well, I don't think so. I think you've got something with your neck going on." Who has the final say on that, so that we feel like we're comfortable keeping the student out or putting them back in?
Josh, how do you? I think that gets into a gray area, and here's why I think it does, and this is what scares me. Around Columbia, we have really good physicians, and I don't say that because I'm part of the physicians here in Columbia. We just have good medicine. We're in a larger area. I worry about this occurring in Somerville, Missouri, right, where there may, the family doc that went through several years ago may or may not understand this. I think that's a problem, and I think that I would assume that it would fall down on the physician to make that call. But I think that as an athletic trainer, and this is a little like this, I think that the athletic trainer needs to have a good discussion with the parents. The problem is, mom or dad may want that kid back on the field, and so then you got to have a good understanding of the coaches. Again, I'm so fortunate every team I take care of, and I take care of a lot of teams in this area. My coaches are really good. At least they trust me. I don't know why, but they do. But I'm very blessed at the coaches. But I think that's a problem, and ultimately that would go to the physician. Josh, can you comment on that?
I think part of it is as well is that as an institution, the institution needs to have a policy. That's why we put these policies and procedures in. So if we have a conflict on that type of stuff, well, you can go in, here's the symptoms that they're reporting, those type of things. Yeah. But for us here in Columbia, college stuff is kind of, we have such a good relationship with our physicians that we kind of work together on that. But that's where the problems do come in. So I think a lot of times at the end, the institution has to step in and go, okay, because, we're the ones that are going to take the brunt of it. What's our, and safe is better than quick.
Yes.
I think it's always the best way to look at it.
And I think the awareness issue in right now in 2016 is concussions are such a hot topic, and I think it'll continue to be for a while. So I think hopefully now we're getting that information out to our Somerville, Missouris. Stephanie.
I'm an athletic trainer here in town. We have that come up sometimes where we will see somebody we think has a concussion. The best thing is communicate with that doctor. I know I've had kids that go to their pediatrician or someone. By the time they get to the physician, they may not show those symptoms, or they may say, I felt fine. That athletic trainer didn't know what they were talking about because they want to play on Friday or whatever it is. Generally, like Josh said, we have a written policy. If we think you have a concussion, that's the only time I would ever go against something a physician ordered, as far as more on the conservative side, and say, you know what, here's the symptoms we saw. He has to go through this progression. When you clear this, then you can participate, and that usually saves you with the parents as well as the physician.
Well, thank you guys. I appreciate it. Enjoy your day.